Dr. Salwa, and I have recently cleared my FRCPath Part 2 in histopathology. And today I am creating this video to share with you the experience of my experience and how I went through it and how I prepared for it and how I could clear it, my exam. So I gave this exam twice and I cleared it in 2 goes, not in 1 go. So as I really want everybody to clear it in the first time itself, and I really felt like making a video out of it and to share it with as many people as I can, so that you can understand how the exam works, what are the challenges in the exam that you will have to face, and how you can actually clear it. So whatever I talk today will be entirely based on my views, on my experiences with the exam, and it's completely up to how I felt about this exam, right? So what are we going to talk today basically is I will just divide my talk into these topics. So I'll first talk about the challenges that this exam has, okay? So that what are you going to face actually, and how can you overcome them, and then what you can or we should not do and what you should do, section wise. That means for every section of the exam I'm going to talk a little bit, and also about the exam days. How can you better prepare yourself for the exam days, and of course before the exam as well, because the last, I would say, 2 weeks, when the exam is approaching, it is kind of confusing because you don't know what to study. You have so many things, you want to revise everything. So I just went over it again, and I have jotted down the points which might help you or guide you or give you a little bit of guidance of how to prepare yourself in the last 14 days and on the exam day, and on the exam eve as well. And also in the end, I will talk a little bit about whatever things are left and which I wanted to share. So the first thing that I want to tell is that there will be things in this exam which are not in your control, right? So I myself, and I am an IMG, an international medical graduate, for this exam, and I am assuming that if you're listening to my lecture, you also are an IMG, because mostly the people who are already working here, they do not really are so unaware of this exam, right? They know how this works. They have been they're familiarized with the system, they know it. So being an IMG is something which does come as a challenge, and but it is something which you cannot control, right? It is not in your hands. Again, the marking system, yes, it is difficult, and that is probably the most difficult thing for of this exam, that it is not how we are used to, yeah, right? They have a particular set of things that they want to give you the marks. Moreover, you can never achieve 100% of the marks, but you do have to get 50% of the marks to clear the exam. But in every case, in every question, you can, at the maximum, maybe you can get 3 out of 5 or 3.5 out of 5, which is around 60 to 70% of the marks. That's the maximum that you can achieve for each question, right? But still you have to be 50% correct overall to get to clear the exam, okay? It's a little difficult to understand for us, but that is something which does bring a quite a lot of challenge. I mean, I think this was the most challenging thing for me, because getting the diagnosis correct becomes, I mean, the margin of error becomes very, very low. The chances that you can make an error becomes very, very low because of the very different marking system that they have, right? So you have to get at least 80 to 90% of the answers correct so that you can clear the exam. Although to say, for saying sake, yes, it is 50%. The marking requirement, the pass marks is 50%, but you're not going to achieve 50% marks. If, for example, if you have 20 questions and you get 10 questions correct, and you have written very well in all of them, still you are not going to get a 50% overall, and you are going to fail the exam. So that is something which is very unique, different and difficult, and it makes it more challenging. But this is something which you should be aware of it, yes, and you should know about it. But this is something which you cannot, it just comes with it. It just comes with the exam. You cannot do anything about it. You just have to understand that it is something which makes it difficult. Yes, it is definitely a difficult exam, right? And that takes me to the third point, which I wanted to say, that this difficulty level of this exam is something, again, which you just have to accept it, that it is there, and you have to know these things, of course, before you embark into this journey. But these are things which you are not going to get into control. So these are the challenges which are going to be there, but everybody faces it, and you have to somehow try to keep that in mind. Yes, you should know this, but to clear the exam, you should, I think, focus on the things which are in your control, right? Which are these, according to me, and that is to get the diagnosis right. That should be the priority. You have to do everything that you can to get the diagnosis correct, right? And that means you have to try at least to get 100% of the diagnosis correct, but probably it is not feasible, or I would say not possible, that you would get 100% of the marks correct, given the time thing that you are in an exam setting. You have to get that correct, and maybe the first 2 or 3 minutes of this time you start seeing the slide, right? Because the time is very limited. So it is not possible to get 100% correct, but yes, that should be your aim, to get every single answer correct, right? And in some sections you hardly have a margin of error of making maybe one mistake, right? And maybe two in surgical pathology, I mean the short cases, but not more than that. So you have to get 80 to 90% correct anyhow, but your aim should be to get 100% of the answers correct. Get the content right. Exactly, this is another thing. Being an IMG, we are not familiar, or we are familiar with our ways, we are familiar with how we have given our exams, but we are not familiar with how the examiners here want our answers. Okay, so this is something which I did not get it correct for the first time around, and that was probably the thing which really made me get very less marks in the first exam, right? So this is something you really have to work on, to know what the examiner is expecting of us, because this here, what do they expect, what does an examiner in this UK setting expect from the student, right? So we have to know that, and we have to get the content right. uh-huh. And sometimes when you're stuck, or maybe you don't get the diagnosis right, still you have to know how to write the answer in a way that you lose the least mark, right? Are not losing too many marks, right? Because you did not get the answer correct, but still you are making it, or you're supporting your answer with the points. And what points should that be, that you would actually get the answer correct? Hmm? Or maybe you will not at least get very less marks. Okay, so that is one thing you'll have to work on. You really have to focus on that to get the content right. The third thing which is in your control is the time management. The time is very limited, yes. It's going to be the same for every student, UK or non-UK student, but this is something which you need to work on and focus on to get it correct for yourself, so that you are able to get write as much as you want. Because if you know that you want to write this and you do not have time, or you have not learned how to do the time management, then you might just miss out on things. And till the time that you have not put it down on the paper, it does not matter what you did and what you learned and what you thought of writing down. You have to write it down for the examiner to know that you know this thing, right? So it is really important to have a time management and to know how to do it, because the time is really very limited. When I was giving my exam in my country, we used to get 5 minutes from our PG exam, exit exam. We had 5 minutes for surgical pathology cases, and it used to be like a rush, but it used to be okay. And when I first learned that they give 10 minutes for each case here, it sounds like it's great and it is too much of time, but actually it is not. All right, it is very less time. 10 minutes is very less time to write out all the things that they require from you and to get the diagnosis correct, right? So these are the things which I found the most challenging, right? So this is my experience, and this is what I think that needs focus, right? Your focus should be on these things as you prepare for your exam. Now, how can you conquer it, right? So talking about that, to get the diagnosis right, it will be the first priority. How can that be done? Of course, you have to start practicing. Whenever you start practicing, you have to start practicing and be in touch with physical slides. I know it might not be possible for some people, but for most of us it should be possible, because you must be attached to somewhere, or maybe doing a clinical attachment, or you're working somewhere, or you can just maybe having your own collection of slides. So be in touch with the physical slides. It is very important to be in touch with them, to be familiar with the it is good to be watching to look at virtual slides, but In an exam, you're actually going to turn, you're not going to just click and the zoom magnification changes. It's not going to happen. You're not just going to click on one place and the field changes. It is not going to happen like that in the exam. So you have to be familiar with the exam mode, right? And the exam is going to be on microscope, so you have to be familiar with the microscope thing. You should be familiar with, you should be fast with it, that as soon as you keep the slide, where do you want to focus it, you have a 2x look, you scan the entire thing first, and then you know where to exactly zoom in to go on 4x. You know how exactly, from 4x, what do you want, do you want to go higher on 10 and 40, or do you just want to stop at 10 or something like that, and you got your diagnosis correct, or which are the 4 areas where you want to focus. Say for example, it's a GIT biopsy. You want to know if you want to focus on the mucosal side of it or on the deeper side of it for later on, but of course first you scan it and then you focus where. And you need not go on 40x all the time if you're very familiar with. Yeah, maybe just one, for confirmation sake, yes, but not necessarily spend a lot of time on that, right? Because you will not have so much time. So you need to be in touch with the physical slides and with the microscope. Okay, that is really important. I understand that sometimes it can be an unfortunate situation that you do not have any access, but for most of us it should not be a problem. And really I hope that all of us can have access to it, because it is one of the most important things, I would say. Next thing is, when you're I'm talking in general, right? How you when you're preparing a theory part of it, right, to know what you want to write, or maybe even to get the diagnosis correct. Sometimes there are things, or there are sections of histopathology which we are very familiar with, right? And you may be good at it, you may be a natural at it, and then those things you do not have to struggle too much, but there will be things which will be your weak points, right? You may not be so good at it. So or you really need to, you have to, when you're presenting yourself to the exam, you have to prepare. It is the duty, the responsibility is on you to have made sure that you are good at all the subjects. You're good in lymphomas, you're good in breast pathology, in female genital tract, in genitourinary, in GIT, in head and neck pathology, in every single thing, right? It is the responsibility is on you to prepare yourself to be good at all the subsections, right? So you need to know where your weak points are. You need to know where you are not good at. You need to know where your confusions lie. And yes, I know some people might be very experienced, or they might think that they know pathology very well, but really I think all of us have our weak points, right? And it is good for us to, if you're good at all of the thing, all the things in all the sections, I mean, it's good for you, it's really good for you. But if you are not, or if you have any confusion, you need to start writing down what all things you need, more time on, what your focus should be on, so that you can bring that section up as well, right? You should not, that should not become a weak point for you, that should not become a negative thing for you, right? When you are preparing, you need to prepare yourself on every section, and give more time to the sections where you have any kind of confusion, right? It may be a confusion in theory, it may be a confusion in maybe the naming, it may be a confusion in identifying, it may be a confusion anywhere, right? So whatever it is, okay, so there are maybe some things which you may not be so familiar with. Say for example, I don't know, I was not very familiar with skin, because I have never worked in an institute where we did a lot of dermatitis and stuff, so I used to find it very difficult. But I really tried to focus on it. I really tried to see slides on, and I really tried to know as much as I could, right? Online sources and this and that and everything. I tried to do all the things, and really, dermatology is something you cannot go without knowing it properly in and out of the things that they can give you. You cannot go to the exam like that, because it's going to be not one case, it's going to be more than one or two cases. It might be 3 cases or 4 cases in the exam out of 20, right? So you need to focus on all the sections, and really work on it, right? And know about it. First of all, you have to know, and then you work on it. The third thing that I want to say is that you can have algorithms in mind, or you should have, basically, and you should have an approach based solving, right? You have to see, sometimes there might, some things maybe like a spot diagnosis. You see it and you know it, and you just go on to the writing part of it. But sometimes you don't know what it is in the first go. So you need to have an algorithm to kind of it may be a systematic approach. Say if it's a GIT or something in which you can go layer wise. You try to see something in the mucosa, or maybe you want to rule out parasites, and then you want to go and see something in the submucosa. Is there anything in there? And then you go down even beyond that and see in the musculatus if there's anything there you can find. So you go in that way. That may be one way of looking at things. Or you may have some points in your mind. Say if you're seeing a bladder biopsy, you want to rule out if it is a papillary lesion or a flat lesion, right? If it's a tumor, or you want to rule out if it's something which is non-tumorous, it's just a maybe an adenoma, nephrogenic adenoma or something like that. So you want to have an algorithm in mind, or you want to have some points in your mind which you want to rule out, or you want to go through quickly when you are looking at the slide, right? And you will have to do this for each section. You should have an algorithm. Say for example, if you're seeing thyroid cytology, what are the things you're going to do? You are first going to assess the cellularity. Yes. Is it more? Is it less? Is there colloid? No. Yes. Cells, if they are there, what kind of sheets? Are they separated or are they clustered together? If they're clustered, are they making any kind of structure like papillae or something? If yes, what are the other findings that can help me in concluding it? Or then you go to the nuclear features and find out if there's anything which can help you. So you need to have an algorithm for every single case, so that when you are given the slide, you just see, okay, it's a breast biopsy. All right, it's a breast biopsy, and so and so is the age and the sex of the patient. All right, so if it's a male patient in a breast biopsy, I'm going to think of these things, right? You rule out those 4 or 5 things which you can have in your mind. So that is how you're going to go, and that should be the case with every single section, right? So any biopsy that you get, or any cytology or anything that you get, you read the history, and from there onwards your algorithm starts, right? And you will have some things in your mind. Okay, I have got this in mind, and I'm going to see these things, and I'm going to rule out, because you have very little time. That is the problem. They have very little time to come to the right diagnosis, and you might think that you have 10 minutes, but you actually need around 6 minutes or 7 to write down your answer. So you basically have only 2 to 3 minutes to come to the answer, to the diagnosis. So it is much better that you prepare yourself as much as you can before the exam. Okay, so you can have points in your mind. You can have mnemonics if you want for each thing, if it helps you. You can do whatever helps you, right? You may have say some instructions for yourself. Say for example, I would rule out amyloid in every single case before signing out, because there may be dual pathologies, and I think amyloid or maybe parasites, these are the things which can come up anywhere, right? And it's very common, and you should not miss it, right? So before signing off any case, even if you have found the answer, you just want to look again, right? And you don't want to miss out any single bit. There might be sometimes there might be just a small bit somewhere, right? And you do not want to miss it out. So you have to go through the scanner first. That is one algorithm that you have to follow every single time. You have to go on the 2x first, and only then go to 4x, 10 and 40, yes, as and when required. Now get the content right. So in this section of what to write, right? Because I told you that there are the marking is very difficult and very different, which we are not kind of used to. So this is what you can do is, to know what to write, you can do these things. You can attend courses for it. That's why people ask you to attend courses, because when you're doing it, they will give you hints, or they will give you a pattern of what is expected. They will give you a list of things which you have to include, right? When you're writing the exam, of course, you need to follow a clean and tidy format, and maybe you can put some subheadings so that it is easier for the examiner to see when they're checking it, right? Maybe when you're writing the impression or the diagnosis, you can maybe underline it so that they know that this is the impression, or maybe you can write it in block letters if that's how you're used to, so that they know that, okay, this is the answer that you have written. Okay, when you're writing the microscopic description, you can maybe write it in a neat paragraph, and you can try to be not random, right? You cannot start your description with 40x. You should try to start your description with, in a systematic way. You start first with what you're seeing on the low power, how the pattern is, how is the circumscription of the tumor or the margins of the tumor itself, and then you go on from outside to inside. Maybe from the cell also, you can go from the outside to the inside cell. How are they size, and then how do they look, what is the cytoplasm like, what is the are the cells close to each other or are they separated from each other, and then how the cytoplasm is and how the nucleus is and how the mitosis is and stuff like that. So you follow a neat pattern, right? And are not random in your writing, right? That is one thing. And of course, writing, the handwriting part is of course another thing. I'm seeing this more because these days we are much more used to our computers than our papers, and that is why I think most of us do not have good writing, or whatever the reason may be. But I think for this exam you really have to give time to write, right? Because that is how you're going to convey to your examiner. So you really need to be good in your writing, in your handwriting, and in your pattern of writing, making headings, trying to make the paper look very neat. When you're writing it on one paper, one side of the sheet, just go on to the next side of the sheet for the other answer. Do not write it in one answer. Leave some space so that it's clearly seen. Okay, the second answer ends here and the third answer starts here. Okay, so those things are basic things about any exam, and we need to follow that. There are no paper limits, so that if you want extra paper, they will give it to you, so that's not a problem at all. Now when you're writing, of course, try to use the buzzwords, right? When you are describing, say, a neuroendocrine tumor, and you know that you want to say that, use the word, right? Use the words which is associated with it, like, say, for example, which is classically associated with it, right? When you say, for example, when you are describing anything, hyaline globules, you're saying that, and then you're trying to describe something like a yolk sac, or something, maybe a chilled over body or something. When you're trying to say those kind of words, right? You know what buzzwords are, like those which can be clearly associated with one entity, in pathology terms, right? So anything that you're trying to say, just do not miss out on those buzzwords. That might just help you. Okay, so even it can just be a pattern. Say, for example, you're describing Burkitt lymphoma, you can just say it's starry sky pattern, right? So those are the buzzwords. Those are the things which you find in the textbooks. Those are the words which you also see in the uh, the figures, the captions in the textbooks. Okay, they usually mention the most important things. So if you have a book and you don't have time to go through all the theory, go to the figures, and in the figures, whatever they have written as a caption, usually the caption is the most important part, the most important thing that they want you to know. So if you can just read those lines, the lines of the figure, under the figures or the pictures, that should give you a lot of buzzwords, right? So salt and pepper chromatin, and like I said, chiller bodies, or whatever, the starry sky pattern, those kind of things. All those things will help you in getting. The person will know that, okay, you know these things, right? You know the what is it? Uh, Now, extra info is something which you need to write in all your answers, and this is going to give you extra marks, of course. So, when you attend your courses, they're going to keep telling you on brownie points, right? This is what brownie points are, that they say. The extra info is going to give you those brownie points, the extra marks, which you need be above and beyond in every single answer. So, for every single case, you actually have to struggle and try to get the maximum marks that you can. Especially if you got the diagnosis right, you do not want to lose out, right? You want to write it very nicely so that you get the maximum marks in each case. Now, when you're writing those points, try to include the most relevant points which you know about it, and the ones that are most what do you call it, talked about. Say, for example, if you're talking about a salivary gland tumor, you can add a lot of points, right? But if you want to add IHC, I think it is not going to help you a lot, because IHC in salivary gland tumors, I don't think it's that important, right? But if you add a genetic to it, I think that's going to give you much more marks. That's going to be more relevant. So IHC in general is very good. We need to write it down wherever it's required. but it's not so relevant, or it's not so used. Nobody does it, right? Nobody, I mean, not exactly for salivary, but there are things which sometimes you don't do IHC for, right? For confirmation. And actually for salivary gland too, I think not too many times we do an IHC for confirmation of the disease, right? Maybe sometimes, but not a lot of times. So it is kind of not relevant, although it's an extra information, and you might show it to the examiner that yes, you know something about this tumor. But really more important would be to say that, oh yeah, this particular tumor is known to have this kind of a fusion, right? And that will help you more. So similarly, you may have other things which wherein, uh, say for example, if you have now another, I don't know, I'm not getting the right example in my mind right now, but sometimes you just don't need IHC. Sometimes the thing is just based on morphology, right? So yes, if you do not have any point in your mind, you can write it off and show that yes, you are showing it off that you have a lot of knowledge. That is all right. But if you have less time, and if you are struggling, then try to give the most relevant points only, right? Because if you have less time, because you will have 20 minutes for two answers, so you cannot eat up your time in making up for one of the case, making up things for one of the case, and then the second case you don't have time. So you have to be, these are the things which is I said time management. This is how you have to know, this is what you need to know, where do I give more time and where do I give less time, right? So if you think that you need more time for this case and you have relevant things to write, then write it down. Otherwise, go to the next case and try to finish it off, right? And then if you save time, yes, you can again go back and make up. If you're just making up points just to add, just for the sake of it, then you can do that later. But try to give relevant points. That's going to give you more weightage to your answer. Yes, using tables is very important, especially when you're doing IHC. I know, I understand, I have been through it. I know that it is not easy. It's not, it's time taking, because you're writing with your pen, and then suddenly you have to go and get your scale and your, I like to make my tables with my pencil and scale. So, pencil and scale, and then, go and make tables, this and that. It's not so easy, but this is the way they want it from you for an IHC table, right? So especially when you're describing things like in a fluid cytology, and you want to describe things between an adenocarcinoma versus a mesothelioma, or maybe a malignant versus non-malignant, whatever it is, you have to make a table there. You have to have your answer, you have to have it there. Okay, so what you can do to make it faster is that you may try to do this practice of writing sometimes in the common things, common differentials. You may just do a little bit of practice, so that you don't have to think and write at that moment, right? When you are giving your exam, you don't have to think and write, because you have done it so many times as a practice. So, but yes, making a table, especially for IHC, that is how they want it. And if it is not possible for you to write it in all the answers, at least try to write it in the ones that wherever you can, wherever it's possible, and how much ever possible, of course, ideally in all of them. When I say all, I mean wherever the IHC tables are required. All right, so now this is what I used for my cases. For my, I came up with this after getting information from a lot of people, from a lot of whomever I could, and from colleagues, of course. And yeah, so this is how I used to write my answers. For the second exam, I wrote this way. Not for the first time, I didn't know at all. So I start with, 4 headings. So the first heading for me is microscopic description, where I write down a paragraph, okay, not bullet points. That's what people suggested me. Insert the buzzwords here, whatever you want to write, some specific things about it. Insert points from the data set here. If you want to write some things like, the tumor is approaching the margin, or it is away from the margin, or say for example, it's not invading into something, maybe whatever, epididymis or something like that, or is it because that changes the TNM, right? So those points where it changes the TNM, and if it is seen in the slide, you really have to mention it. And I think this is the best place to mention it. When you're writing the microscopic description, you can write it down that yes, this thing is happening here, right? So say for example, if you have a lung tumor, and it is going to the pleura, then you have to mention it that it is touching the pleura, right? Because that's something which you're going to confirm on microscopy anyway, and it's going to change the T stage. So that's something which you have to write. Or tumors where the size is important, right? So some tumors the size is not so important, but like in say GIT, but in the others size is important, and you just have to keep your scale ready, and you just have to give an approximate thing. Just try to measure it on the microscope or on the on slide itself, and just give it off, give the T, right? The T size can be given, and it should be given. That's the one thing that you can give from one slide, the TNM. So at least this much, so and so size, right? Again, then if it is say for example a melanoma or something, then you have to give the levels, right? Those are the things which are described on microscopy. So when you are seeing the slide, it is expected from you to give those points. So these are some things which you cannot miss. So anything from the data set which is important, especially if it's a core data item, and if it is seen on that slide, then you can mention it. And if it is not seen and you do not have any other thing in your mind, then you can, if you have time, you can write it down that okay, this is not seen, so maybe I will take an extra section and to find out whatever, right? So the next topic or the next heading for me is impression or a diagnosis, whichever word you like. I like the word impression. And if I am not able to come to a diagnosis, one particular answer, and there'll be times which will happen, it will happen. I told you nobody can give 100% correct diagnosis in the exam setting, right? So it is very difficult. So sometimes you might have to resort to differentials. So whatever, if you want to give a differential, give it here. So you might want to make it bold, or you want to maybe make it, you want to write it in all in capital letters, the answer here, if you want. So the diagnosis, of course, much more preferable than the differential diagnosis, but it is much better sometimes when you are just not sure to give a differential and save yourself, rather than committing to one thing and then your marks getting cut. So this is the challenge that I was talking about. This is the thing, to get the answer right. That is a huge challenge, and you should the thing, how to know how you're going to proceed in one case. Are you going to be sure to commit it, or sometimes it's confusing and you don't want to commit it? Then how are you going to put it in a way that you do not lose too many marks, right? You put a differential in a way, you write out that okay, I'm thinking of this versus this, but these are the things that are favoring this, and these are the things that are favoring this. So what are you going to do next to clear that doubt? So I'm going to do maybe IHC to clear it. Sometimes you may say that I want to go to somebody else and clear it out, but only sometimes. Not maybe 1 in 20 answers can be like that, not all of them, right? And or maybe sometimes you can say that I will do a genetics, or maybe a clinical correlation, or this or that, or radiological correlation, or whatever. So you can say all that, uh, but of course it is much better to give a diagnosis straight away. But that's a call which you have to make. You cannot make all the answers into a DD in a differential diagnosis differential, and you cannot have it all the diagnosis, and of course that is not possible. But try not to have too many answers which are differentials, right? So because that will not give you too many marks. So when you are giving an impression or diagnosis, I think you should be familiar with it. Yes, if you should be one line thing, the main diagnosis, that word or the diagnosis has to be something which is the most recent term that is being used, right? So if you go on the FRCPath exam um, virtual leads site, and you see the slides, and you there are exams where they have given notes, right? For every answer, how have they marked it, right? You have to go through all of that so that you get a good grasp of how they mark your answers. So sometimes they have I remember specifically about one of the cases where they said that somebody who has written it as a MMMT, and somebody who has written it as a carcinosarcoma. So the new term is acceptable, but the old term is not acceptable, or both are the same things. But if you say MMT, you're not going to get marks, and if you say that it is a carcinosarcoma, then you get a marks. So you have to be familiar with what the newest terminology is, and then you have to write that terminology, right? And sometimes you will have to give a diagnosis which is okay, you give a diagnosis, and I think it is better to write the organ as well. Say you're seeing a squamous cell carcinoma, you don't write squamous cell carcinoma, but I don't know, that's just how the way I was taught, so I like it this way. And it's good that you write down squamous cell carcinoma of the bladder, or squamous cell carcinoma of the larynx, or squamous cell carcinoma of something something. So whatever it is, you mention the organ along with the thing. But try to, so that if somebody looks at only the impression of the diagnosis line, they know what the diagnosis was and know what the organ was, so exactly what they are talking about, and then you can continue from there. But of course it depends on you, however you have been taught. But yes, the numerous terminology is something you have to keep in mind. You have to put that in words, yeah, right? The latest terminology. Otherwise you will lose marks. If you're writing differentials, when you're writing differentials, you cannot have a list of them, right? So you cannot have a lot of them, except for, say, example, when it is maybe one or two, I think, ideally. You're having confusion between one or two things, this or this. That's all, that much is allowed. But say, for example, it is something very broad, or like a small round blue cell tumor, which is very common, by the way. They give that in the exam. Now, if it's a small round blue cell tumor, according to the site, you should be writing the differentials. So if it is a nasal cavity, you are supposed to put in some things there, right? And you are supposed to put that first, right? And you can have 3 or 4 differentials there. But if it is, say, for another some other site, some other place, say for example, if it's the skin and you have a small round blue cell tumor, you're going to put only 2-3 things there. You cannot have, although there are everything comes into the differential of a small round blue cell tumor, but according to the site it's going to change. You'll have 2-3 things, yeah, right? You can put those 2-3 things, and then that's it. You have to go you have to go on to the second, third thing which you have to write. You cannot have too many differentials. So especially for a small round blue cell tumor, because it is an exam favorite, and there are too many differentials, please go through it site wise and have 2 or 3 differentials, or maximum 4 differentials. Maybe lymphoma is something which you can have at all sites, but otherwise you need to have you need to know which site what differential comes first. Okay, and accordingly you will make a table for IHCs, so that part is important. Okay, but otherwise, for other cases where maybe you got confused and you wrote it as a differential and somebody else got it right and somebody else got it correct, those cases I think you can have 1 or 2 differentials, maybe maximum 3. I don't think you should have more than that, because things which can only be answered on IHC, those cases, yes, you can go for a little more, because you have to be a little wide. You need to show that yes, you are thinking of everything, but again, not more than 4 in any case. And the third heading would be the extra information, which I said, which will give you extra marks, which you require for all the answers ideally, but maybe you will not know what to write. So maybe these are the things which I used to keep in mind, and I used to go through these, so that if I have 1 or 2, 3 things from here, I can just write it down as something. So if I know that it's a common tumor, or is it a rare tumor, or it's uncommon tumor, so you can write that as one line. So it's a very common tumor, or maybe it's common in this age group, or it is not common in this age group, or both of them will make a point, so that you know that okay, this tumor is found in this age group, or if it's common in this site. So if I have a granular cell tumor and it's in the head and neck, okay, I will say that it was commonly seen in the head and neck. It is a common area. It's a common thing to see it maybe in the tongue. So if it is not, I would say that it is rare, or maybe not common in this age group. Okay, so you can make this one point, you can make a line out of it, and according to the age and the site, you can call it common or rare, right? Tables for IHC, again, this can go into the extra information, that this case is known to have this IHC pattern. If that's just one diagnosis you have, okay, this I expect this to show this diagnosis, right? If it's something which you require for your diagnosis, then you don't use the word expect. You say that I will do IHC and find out if uh, it's showing these patterns. But if it's something which you don't need to go, say for example granular cell tumor, you don't have to do IHC for it to get to an answer, but you still want to show to the examiner that you know it. So you will say, I will expect this tumor to come positive for so and so and so and so, IHCs, right? If you want to add more information, if you have time, you can say I expect a so and so positivity, say for example nuclear positivity in this for this IHC in this case, or cytoplasmic positivity. There is no limit. Okay, and it's not like we don't know. All of us know all these things, the basic things all of us know, but the time is the time management. That's why it said it's the most important thing. And you need to know how much time you have and how much you can put it on paper, right? If you have somehow magically you have some time in your hand, yes, go for it, right? As much as you want, okay, all the relevant information. But practically it is not possible. You will not be able to write everything. But yes, ideally everything should be put in there as much as you can. But that's why I tried to put it into headings so that I can have something in each heading, right? And yes, that's how you have to do. Genetics, of course, wherever possible, wherever relevant, especially I would say in soft tissue and salivary gland tumors and many others, right? You have a lot of genetics these days, and maybe even I don't know, maybe even in whichever you know, whatever you have learned, if you know it, you can write it down. It's not going to harm you, okay? But yes, when the time is limited, then you have to make a call. If it's something which is very relevant, or you are not sure, do you really want to write it and waste your time, or do you just want to write something much more relevant to it? Okay, if there's a syndromic or a familial association known, yes, you should try to make a point out of it. And usually, there will be a lot of, not all the cases you can know all the associations, but some cases are commonly known for being for having a syndromic association. So those cases I think you should not miss out. So you should be able to write, say for example, if it's just, I think you should make a point and you should write about it, that it's known to have this kind of an association. So that's what you need to know, where it is more important and where you should not miss it, right? Again, prognosis and also the management, what is going to be done to it. Are you going to go for surgery, or are you going to go for chemo, or is it going to be just left alone for maybe conservative treatment or wait and watch? Whatever, you can make a point out of that. And also for the prognosis, it's known to be good prognosis. Say if you have a tumor which is known to have an extremely bad prognosis, you have to mention it. You have to, because it's something which is really important, and I think everybody expects you to know it, right? But there will be tumors which will not have any effect on the patient whatsoever, so you can just leave it and you say that okay, it can be left alone, and the prognosis is excellent for this case. But so management, like if it requires surgery, urgent surgery, etc., and prognosis, I think those are things which shows that you are not just concerned with the slide, but you're concerned with about the patient. Okay, so these are the two things which will show that you actually care about the patient. You know what your report is going to have effect on that patient. Is he going to die soon? Is he going to live long? Is he going to be treated? Is he going to be operated? So those things, right? You need to show them that you are not just a good pathologist, but a great one, right? And a great pathologist should be aware uh, and concerned about the patient, and not only about the slide, right? So how we prepare for the exam is we try to prepare only for the slides, right? We just want a case, that's it. But if you start getting an overall picture of the case, like each case that you report, you start to think about it, like, is it going to be good for my patient? What have I written for this patient? Is it something which I've written like a death sentence for the patient, or have I given a good news to the patient? So if that's the way you do in your daily life, I think then it's going to be really easy for you to get these extra information, because you already know, right? And this is something which they want from you, and that's how they're going to mark you. So if you know these things, yes, you are great and you will get more marks. Yes, the fourth thing, or maybe you can just add it in your extra information, is the plan. Meaning, if you want to do a clinical pathological correlation, if you want to do a MDT discussion, if you are doing an MDT discussion, yes, I will tell you that in UK each and every single cancer case, so if you're calling something as a cancer, it is going to go for an MDT discussion, right? So you have to write that for all the cases which you're giving as a malignant. All the malignant cases are going to go for MDT discussion, and even the inflammatory bowel diseases, they have their own MDTs. The dermatitis cases, they have their own MDTs. So all those can go for MDT discussion. And they may go for MDT discussion for a lot of reasons. So you can include 1 or 2 reasons why you want it to be discussed in MDT. Maybe you want some extra information. Maybe you want the patient to be, uh, I don't know, maybe something to be done to the patient, or you want, say for example, you're suspecting a syndromic association, so you want them to find out if he has anything else, whatever the case may be. You want to know. You want to know the radiologically how much is the extent of the tumor, and to go for the TNM something. So give a reason why you want to do an MDT discussion. That would be better. And maybe you want to correlate with radiology. Maybe, like I said before, second opinion from a specialist, but this cannot come in all of the answers. May come in 1 or 2 of the answers. Maybe in a lymphoma case or something, you may get a second opinion from a specialist. So sometimes it is allowed, or it is preferable actually, that you get a second opinion rather than giving a diagnosis on your own. So basically, you have to make a balance in being confident and still being in the safe side, on the safer side, right? So if you want to be confident and write off all the answers on your own, even if you are, you still have to show that yes, you're taking precautions, or you're cautious at some point. So whenever it is required, or it may be wise, you can take a second opinion from a specialist. Yes, not a problem, but of course, as I said, not in all the cases. So this is kind of a sample thing which I made for myself. This used to be in my mind, and when I was writing the answer, it helps you, right? So you start off writing and you do not miss anything, and you get to write something in each of them, and it becomes like a full page of answer. Okay, so that's what I did. Now, time management, I have 3 advices. First one would be to practice writing in a timed setting, so that you can put an alarm or a stopwatch with you. I actually took my stopwatch with me in the exam as well, although you have clocks everywhere in the exam, but still you're allowed to do that, and if you want you can do it. But at home it is required from you that you do it. You have to put your stopwatch next to you, and you have to write answers as if you're getting into an exam. And when you're doing that at home setting, try to give yourself maximum of 8 minutes, right? Not more than that. So when you are used to writing in 8 minutes, then you will be very comfortable in writing in 10 minutes. So you do that, and do not take it lightly, this advice. So the second advice is also to practice writing, and whatever I said for the first one is the same thing. I want to say again, I want to repeat it again, that you really have to, you cannot miss this. You have to, this is going to be a major what do you call it, part of your preparation of your exam, and you have to do it every single day, as much as possible. And third advice is also to practice writing, and you should remember that the more you do, the more it's going to help you, because you will know things, you will know where you are lacking, you will know how much more you need to practice your slides, you'll know how much more you need to practice your theory, you'll know how much you need to know about some disease and extra information. Or is it helping you, the information you already know, or you're not going to read extra, or use this stuff about it. You will know exactly what I need to know about this, so that I can write it down in my answers. Okay, so you need to practice writing a lot, and each time you do that, try to do it in a timed fashion. Maybe when you start you can do it with 10 minutes, but come down to at least 8. So when you're doing it, at least 1 month before the exam, you should be able to write all the points that I said before in 8 minutes. If you are able to do that in at home setting, you will be very comfortable in the exam setting, and in 10 minutes. Okay, so I think that's very important, because you really will find it very challenging. If you don't do this, you will find, and that's what happened with me in the first time that I gave my exam. I had not done this, and really I think this was the thing that helped me the most for my second exam. Now coming to the second or the third part of the talk, which is do's and don'ts, and I'm going to go section wise. Yes, it's going to be long, but hopefully it's going to be helpful. So the exam days, you might be knowing that they are divided into 2 days. The exam, 2 full days, and the first day is usually on a Tuesday, and the first part of the day is cytology usually, right? The first half. There are only 8 cases, but like I said, you ideally you have to get 100% of the cases correct. Maybe you can get one of them wrong, but not more than one wrong. So you will have a lunch break or something in between, and then you will have the three things: frozen section, long cases, and OSPI1 Viva. Now these three can, there are 6 cases for frozen, 4 cases for long, and OSPI1 Viva. Now these can get jumbled up, or it may just go in one after the other. It depends. It's not fixed because everybody is giving the exam at the same time. So it gets, maybe you will get the first set of frozen section first, and then you will get a long case, and then you will get OSPI, and then you will get the second set of frozen section, and then you will get something else, and like that. Okay, so but anyways, so this is your first day. Then comes your second day, and that's usually the consecutive next day or Wednesday, and you start with your short surgicals, which is a marathon. Okay, it's the most difficult part of the exam. 20 cases in one go with one break maybe in between, and 20 minutes break in between, and everybody's giving the exam together, so you can get any number first, but you will finish all your 20 cases together. All of you will finish it together, all the students together. Then you have your lunch break, and then you are done with your microscope. So no more seeing the microscope after that, only vivas. So those will be gross cases, which will be 4 cases, right? And then you will have the OSPI2, which will be writing but no seeing the microscope as such. So this is the exam. It is very hectic, it is very tiring, exhausting, taxing. It is difficult. Okay, but you need to know every aspect of it. You need to know exactly where you can, how you can go through it, and you can overcome it, right? That's the challenge basically. That's why we're talking today. So now I will go through each section one by one, and I will tell you things. I will give you my inputs about how I felt about the exam, and what I did wrong in the first time and what I did correct in the second time, which I feel. And also I will tell you what books I used and what material I used, and what to do on exam day specifically, and what you can do for preparation part, and especially with exam. Okay, so preparing cytology, you need to practice slides, because first of all, virtual slides are not as much available as the histo slides, right? You will have very less slides anyways. And apart from that, also I think cytology cases are they are very different. They look very different when you are seeing it. If you're not very used to it, or if you're not seen it for a very long time, even a simple neutrophil or lymphocyte might just look very bad to you, or they might just look very big, or something different to you. So you need to be very familiar with how a cell is looking like in a cytology, right? You need to see as many slides as possible. Now, how you're going to do that, I am not sure. I really hope that all of you have enough slides with you as a collection, or maybe you have access to some institute where they can let you see the slides, their collection. But really, try to figure that out, and do it as much as possible. Okay, it's going to help you. For me, first time that I gave the exam, definitely I did not see too many slides, but really the second time I was lucky enough to have a clinical attachment, and I went through the slide boxes and boxes, and not once. I did that multiple times, and for I think that really helped me. Okay, so that's something which you really should try to find out how you can do it. And when you're seeing the slides, like I said about boxes, you should try and see positive and negative cases both. Why I'm saying that, especially because cases like urine cytology, where you can have a negative case as well, cases like fluid cytology, where you can have a negative case or non-malignant cases, I'm telling you, it becomes very difficult. Yes, you would be very good in finding out things which are positive if you're seeing boxes or collections. But mostly people, yeah, I mean, even if you start collecting something and you start making a box, you're going to keep slides which have some positive findings, and which are negatives, you just leave it off. But when you're that's when people make the collection boxes. But when you are actually giving your exam, you can have a positive or a negative case, and if you're not used to your negative cases, you might miss out on them. Okay, it happens, it happens. So try to see the positive cases, positive findings, definitely, especially for urine and fluid cytology, because these are cases which will definitely be there in the exam. Okay, fluid, probably there'll be 2 cases of fluid, and urine cytology, probably there'll be 1. So 2 or 3 cases these are. You need to know how a negative looks like. You need to know how those benign findings are, right? So try to see both the things. Okay, then have some slides for exam day. Yes, so was a beautiful advice given to me by one of the online teachers that we have. So he said that for your exam day, it's the first thing of your exam. Cytology is the first section. You go there on the first day. Maybe you're not even using your own microscope, and you start seeing off with cytology. And most people, they fail in cytology. That most people, they when they fail in exam, they fail in cytology, and that is because it is the first exam. You have only 8 cases, and you have to have all of them correct. And when you start your slide with the first case, that first case is the most difficult, because your eyes are still kind of adjusting to the cells and the sizes and the morphology and everything. So it is much preferable and advisable to have a slide um, for the exam day, maybe 1 or 2 or 3, or how many ever you want, and you can just see them, just keep looking at them 5 minutes before the exam starts, before that bell goes off. Just see those cases for 5-10 minutes, so that your eyes are used to it, and then when you get your exam slides, then you're kind of familiarized yourself with it, so it really helps. Okay, so it's a beautiful piece of advice, and I really followed it. I had some cases with me, I did that, and I think it really works. It really helps. Know the scope of diagnosis for exam purpose. This is really, really, really important for cytology, because they cannot have multiple copies of the I mean, you all know biopsy is easier to have another section, right? And you send it off to different centers. But cytology exam, you can have only so many slides for a case, and it is very rare to have rare diagnosis and those things. It's not possible to have multiple slides so that it can be sent all over the centers for exam purposes. So in cytology, you really need to know where your focus is. Now this is something which I did a mistake in my first time when I gave the exam. What I did was I started thinking of basically all the case things that I would have thought of. Even if it was negative, I was thinking of imagining things and writing off something. So that was something really I did wrong. I made a mistake, because you need to know that cytology, they're not going to give you anything. This is not one of the sections where you will be given anything. Okay, it is one of the sections where you will be given only a few things, and especially if you're following a classification system, okay, it is for going to follow only 2 or 3 classes. Okay, only these things, and you have to focus only on those sections, and you have to make your diagnosis fitting one of those, and you will get your answers correct. I think that's how I cleared it the second time, because you cannot have a lot of things going on in your mind. You don't need to. So you need to know the scope. What are the things that they're going to give in terms of even the site or the location? FNACs, you need to know, okay, I have to study and focus on these things, right? They're not going to give you a soft tissue tumor FNAC. You don't have to waste your time on that. You need to know, okay, I'm going to get thyroid. I'm going to study thyroid. I can study salivary gland. Maybe breast. Not very common, but yeah, maybe breast. Maybe whatever the fluids, right? No gynec path, no gynec cytology. So not that is off the table. Then you have to think about fluid cytology. Of course, you give the most time, and practice the most. Write it down as much as many times as you can. Okay, fluid cytology, urine cytology, pancreatic FNACs and stuff. That's common. Brush, all these lung things, EBUS and stuff. Those things, all those things are the most important ones. You have to prepare yourself. You cannot not prepare yourself. Okay, but amongst all of them, you should know are the categories which can come in the exam. Okay, the indefinite ones, the the inadequate ones, they're not going to come in the exam. They're not testing you for this. Okay, it's not a real life problem. It's an exam case. They're going to give you only the cases which are either negative or positive, or maybe suspicious of malignancy, those things are not going to come. Malignant, yes. Benign, yes. Benign and whatever, those things, yes. But but not inadequate, indefinite, suspicious, those things are not going to come. Okay. For more details on these, I will tell you about a lecture which I also heard, and I think I must have heard that lecture at least 10 times before giving the exam. Okay. And you really have to listen to that lecture for preparing your cytology exams, to really know the scope, what all things can be asked. Okay. I'll share that with you now. And then you again have to do practice time writing, although in this part of the exam you are not so much pressed for time, but yes, it's always good to have a know what you want to write. Okay. And then remember the common classification systems. Okay. Now when you're doing the classification systems, these are the books that I basically studied, and the classification systems are these. So you have one for urine cytology, you have one for salivary gland, you have one for serous fluid, and for pancreatic biliary, and for breast. You will see that I have not written Bethesda system for thyroid reporting because that is not used in UK. So go to the UK data sets, go to the thyroid cytology, and you will see the way they report it here. That's in terms of Thai 1, Thai 2, Thai 3, Thai 4, Thai 5. Okay. So again, not all the Thai 1, 2, 3, 4, 5 will come in the exam. There will be only few things that will come in the exam, and that's the only thing that you have to focus on and you have to write on. And for those, you need to know what extra points I'm going to write. That's it. So cytology, you have to be really focused. You really have to know what you have to study, right? You really have to know that what, yeah, they're going to ask you, and read only that much. And yeah, just don't go very broad in cytology. You can stick to very few things, very few entities. Okay, these are the other books, the ones that are below. Mostly these are case studies kind of thing. Okay, and these are basically the ones that I practiced kind of on a daily basis, maybe 10 cases or 15 cases, as and when you get time. So my pattern of studying was I used to give each section time every day. So every section I used to give it a little bit of time every day, depending on how much I have to give time. So I, of course, cytology and surgical pathology takes more time, of course, of yours. But the others can take a little less time. But yes, I give time to every section every single day. So I would give 10 or 15, 20 cases in one day, right? And you just go through it like it's just like a practice. So these are the books part of it. And now coming to the online material, of course, you have this John Hopkins website, very good, very nice. You have some cases around 56 or to 50 to 60 cases here, but these are in the form of pictures. That's something which I do not like because those are already focused. You already know what you have to see, and you just come to the answer. You already have a history, and you already have cells staring at you, so there's not too much of a challenge here. But yes, sometimes they give you a differential, they give you a way of writing, the way they describe things. So those are the things that you can pick up from this website. So it's a very good website, and only 50-60 cases. They're not too many. You can go to through one or two cases in a day, maybe on a daily basis, just to pick up the words, the pattern, how they write, and the things on which you need to focus when you are seeing a slide, or the common cases which can come in the exam, those kind of things. Yes, it is a helpful one. You should go through it, and it's not too many, and it's not difficult to go through it. So please try out this website, John Hopkins Medicine Pathology Cytopathology Unknown Conference. It is called. So yes, this is one important thing. Of course, on virtual pathology side, you do not have too many things on cytology, but you do have a small organ-wise section where they have arranged size organ-wise, and in that you have one section of cytology. Whatever is available there, you need to go through it because these are at least these are virtual slides. These are not like pictures here, okay, but these are actual slides there, so you know where to focus, right? And so it's not like you are being fed, like like it's the cells are already shown to you and you just have to answer them like a spot diagnosis. So I don't like that part when I'm practicing it, but yes, we don't have too much of an option when you're doing cytology. This is the lecture that I was talking about. This is the Dr. Ahmed Ali, and really have to thank him a lot for his lectures. I am telling you that these are around 2.5 hours together, part 1 and part 2. I must have listened to these lectures at least, I told you, over a dozen times, and I actually made notes out of what he says. and everything that he says from the beginning to the end is important, is helpful, is is guides you. Okay, I mean, I cannot stop praising him. I don't know him, but yes, I have attended his lectures once or twice online when he was doing the calls, and then I came to know about this, and this is like really one of the most useful things, especially for this exam, because he tells you things about the exam. So you know what things can come, what things cannot come, where you should focus, what you should write, those kind of things. So you really, 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 really have to, if you're giving the exam, if you're serious about it, you have to go through this as many times as you can. Okay, it's not a one-time thing. Just go through it as many times as you can. And yes, he has more lectures about different things, and it is highly, highly, highly advisable from my side to go through all the lectures of his. Okay, because they are amazing. The way he tells them, it's amazing. Now for the exam day, what are you supposed to do? You need to read the questions and the history very, very carefully. Again, another piece of advice with somebody in some course, they said this, and I really, really, really found it very helpful, because you know, you miss out. It's going to be very subtle. It's going to be one line history, but it's going to have hints there. It's going to have the answer, maybe, you know, or a clue to the answer there. Okay, many a times. So you really need to focus on what is the question, what is the history that they have given. Okay, and you don't have to think that they are trying to trick you. Okay, so it is mostly helpful. Okay, it's mostly helpful. It's if it's supposing it says that I don't know what to say, but yeah, whatever, if it says that whatever it says, it's usually to help you out. Okay, so there will be questions which may not be helpful. Like for example, I think in surgical pathology cases, should the short surgicals, they're not too helpful. Okay, but in others, I think it's usually helpful. If you really can pay attention to it, you can make some differentials right from reading the question. Okay, and then when you see the slide, it really helps you a lot. So it can happen that you read it, you went to the slide, you saw something, and then you're confused. At that moment when you're getting confused, just go back to the question once again. Just do it. You might just get the answer. It might just click you. Okay, because you will get some hint out of that, and then it'll just help you. So just keep going back and forth if at all that is required. Not in all the cases, because you will lose time, but once in a while, if it's required that you're just stuck in something and you're not getting an answer, you don't know what it is, just try to go to the question again and read it very, very carefully. You might just get a very subtle hint which might just help you in coming to a diagnosis. Okay, uh, again, answers need not be too elaborate for the C section, because you don't really have to write too many things in the plan or too many things in the extra info, but yes, as much as you can. You have to write, and especially MDT discussion, if it is going to the case is going to go for an MDT discussion, you have to mention that you need to have an MDT discussion if it's malignant. But and if it's an IHC which is required, especially for fluid cytology, yes, you have to write that for sure. But the microscopy part of it, not too many points, maybe 3 or 4 lines describing the cells, and yeah, maybe if there's a very characteristic finding, yes, and yeah, and the diagnosis. Now in case of a negative finding, so when you're not seeing anything at that time, getting an extra info becomes very difficult. So that kind of is a challenging, or maybe it's one of those cases where you cannot actually gain too many points, gain a brownie points and extra points. Okay, and there you can just focus on seeing the slide and getting the right diagnosis, and maybe just say that yes, it's just negative. Maybe you can add things in the plan, that you know you will want to do a clinical correlation, or if it is actually not correlating with the clinical things or the radiological thing, then you will go for the so and so, or you will want a repeat thing to be done, something like that, to be double sure. Maybe you can add some things like that which you may be doing in your real life as well, right? You just can add those things, and that's it. That you cannot add too many things in it, and you may just want here in such cases to just get the minimum pass marks there, right? Please remember that you have to it's one of those sections which is the most difficult, because you start your exams with it, and if it goes wrong, you really are, your mood, it just goes off for the next 2 days, right? You feel like it's all over. but try to overcome that. Try to just because you never know what you have done, just give it your best shot, know everything beforehand, and write as good as you can. So uh, uh, just yeah, just have to be very careful in what you're doing, and not be too uh, do not get uh, if it goes wrong, if something goes wrong, do not get sad or be depressed by it or anything like that. Yeah, don't let it get you. All right. So here, of course, you can give more time to your diagnosis. Try to see it again and again and again and again till you come to the right diagnosis. You will get 4 sets of slides. Each set will have uh, each set of slides will have 2 cases. Right now, those 2 cases, sometimes there will be 1 slide per case, or sometimes there may be 2 slides, or there may be one tray. You may get 1 slide. I mean 2 cases, right? So 2 slides or 3 slides or 4 slides. Okay, so you can have pap and a Jimsa, okay, for 1 case, and 1 case with only pap or Jimsa. So this happened with me for one of the sections. I actually missed seeing out one of the slides because there were 3 slides and I thought I have finished all of them, but actually I did not. I saw only 2 of them. So things like that happen, right? So but the next time around I was very, very careful to see all of them. So that's why this is one of the points that I wanted to share with you people, that please do not forget to see both the slides if 2 slides are provided, and both the cases. For each set there will be 2 cases for sure, no matter maybe 1 or 2 slide, that is okay, but there will be 2 cases on each set, on each set that you get. And be sure in that 20 minutes you have seen those both the cases. Okay, so it has happened with me once, and I of course lost a lot of points there in my cytology exam. So do not make that mistake. Do not think of any rare diagnosis. Again, to just repeat that, do not think too much. Be very, very focused on the section that you're talking about, on the case that you're talking about, on the organ that you're talking about. It's not going to be something really rare, it's going to be something common. Okay, that is not the challenge here. That is not the challenge. The challenge is it's actually not very challenging, the FNAC part of it. The most challenging thing I think in this is that, saying a negative from a positive case. Okay, because pancreatic situations, it may become difficult in the uh, even in the brush biopsies, brush cytology from lung or the biliary tract. Those things become very difficult to call it a negative from a malignant, right? Getting the right entity is actually not that important in cytology. If you call something malignant, it's fine, they will do something else, they will send you the specimen later on, you can get that, you have time for all of that, even practically thinking. But getting it correct, if the patient has to go for surgery or not, that is the main challenge, right? Even in daily practice, and that is exactly the challenge in the exam as well. So things like fluid, things like I told you, urine and EBUS biopsies and biliary tract brushings and all those things, getting it correct, is it negative, is it positive? And those are mostly the 2 things which will come in an exam. If it's either negative or positive, so you have to make a choice and you have to come to the right conclusion, right? But you don't have to really think of rare things here, right? And you don't have to think of that unless there's something which is uh, come up suddenly, or maybe like a dual pathology. Say for example, you somehow get a parasite in one of the slides, so that's a different issue. If you see something very evidently, you call it that. um, but you really don't have to think of anything rare. And wherever required, wherever relevant, you write down the classification systems. For thyroid, please remember, it's not the Bethesda system that's being used, it's the FRCPath has their own way of reporting it, and you should write that down. Wherever applicable, you need to write it down because it will give you points, right? So before we go on to the frozen section and the others, I think I would like to take a break here because it's getting very long, and I'll see you guys after the break. You can join me if you are liking this lecture, or if you can, yeah, you can let me know if you do not like this lecture or the way that I said or anything about it, or if you want to find any kind of comments. It's just welcome. Okay, all kinds of feedbacks and comments are welcome. So yeah, I would like to listen from you people. Meanwhile, we will take a break, and I will get back for the rest of the talk, and I'll finish with all the sections, and then I'll give you my experiences or my advices for the last 14 days before the exam, and yeah, a few more things. Thank you so much.